All right, what's up, guys? Welcome back to Hacking the Headlines. So, I came across this clip from CBS this morning, and it is a perfect example of how the mainstream media causes massive amounts of fear and panic with their lies, deception, and manipulation. Now, this video is titled New York City Digs Mass Graves in Potter's Field for Unclaimed CV Victims. Now, the only problem with that is that this Potter's Field place in New York, it's always been used to bury people who are unknown, people who can't afford funeral services, people who are in prison. So it's always been used for this purpose. But here they're trying to, show this fear-mongering footage of people being buried in these mass graves, and they're claiming it's all CV victims. And now after this clip, I'm going to show you how they are purposefully inflating the numbers. This is absolutely provable beyond any shadow of a doubt. You can't deny it. The CDC themselves are admitting they are doing this. But let's take a listen to this clip first, and it's just unbelievable.
We begin today with an alarming new milestone right here in America. New York State now has more reported coronavirus cases than any country in the world. Let that sink in for just a second. And new pictures.
Yeah, let that sink in for just a second. They are claiming that the United States and New York City in particular has more cases than anywhere else in the world. How is that possible? When we have places like India that have pretty much the worst living conditions on earth. They have people stacked on top of one another without as much as a running toilet, yet they're not exploding in their numbers. But us, we're on lockdown. No one's even leaving their houses, yet the numbers have continued to explode and spread like wildfire. It makes no sense.
Are a disturbing reminder of the human toll of that. This is a mass grave being dug for coronavirus victims at New York City's Potter's Field, where unclaimed bodies are laid to rest.
And there's your fear-mongering footage. There's your scare tactics in order to convince people that something needs to be done. The pre-planned solution has to be rolled out. And in this instance, it looks like it's going to be a chemical cocktail injection that they want injected into each and every one of our bloodstreams. Okay, but first they have to really scare us. And showing this footage, which again, this has been going on for decades in Potter's Field, where they bury the unclaimed people and prisoners and, the homeless people. But they're showing this footage as if it's something new and that, oh, look at how many mass graves we're having to dig for all the CV victims, even though the CDC themselves came out and said that really the numbers are completely hyperinflated.
Yeah, it's a reminder there that the poorest and most marginal are bearing the greatest burden in this crisis. And it's a widening crisis. More than 466,000 COVID cases reported nationwide, and the death toll is now well above 16,000. But there are signs of improvement. Hospital admissions from the virus are declining in New York and California, two of the hardest hit states. Our lead national correspondent, David Begnaud, is here in New York at the U.S. Naval Hospital ship The Comfort. David, good morning. So we've been hearing about deadliest days in New York for several days in a row, but we may be hitting a turning point, turning a corner. How so?
Okay, then we have this guy who is in the outside open air with nobody around him except maybe a cameraman who I'm sure is 6 feet away practicing social distancing, and he's wearing a mask. I mean, why do you think that is? Because it's propaganda. They have to scare people into thinking that this is way worse than it actually is, even though Dr. Fauci himself, the lead expert in this whole thing, released I'm sure a lot of you guys saw it, the article released in the New England Journal of Medicine, where he says it's really akin to a severe seasonal flu with a 0.1 mortality rate. Okay, this is one of the most prestigious medical journals in the world that's really meant for only other doctors to be reading. So why in the world would he be writing that in the New England Journal of Medicine? It makes zero sense. Just like this guy wearing a mask also makes zero sense.
Well, maybe so, Tony, and let me tell you why. In speaking with one of the commanders here on the ship yesterday, I said to him, how come you've only treated 100 patients or so when you have capacity for so much more? And he said, sir, we're just not getting that many patients coming to us. The need doesn't exist. So we called the governor's office, and the governor's office told us this. There are 90,000 hospital beds statewide because they've had to add so many in recent weeks. But only 18,000 of them are actually filled. So yeah, this is really good news, but every time we get good news like that, it seems to always be said right alongside something that is stunning, like this. So many people are dying in New York City due to coronavirus complications that the morgues are crowded, to the point where new graves are being dug off Hart Island near the Bronx.
And there's more fear porn, more fear mongering, trying to say that these hospitals are overrun, they can't deal with it. Yet, all the videos online where people are going to these hospitals, it's business as usual. Or even more than that, they're way less busy than usual. And the doctors and the nurses are just sitting around waiting for someone to show up.
Are burying unclaimed bodies that have been at the morgue for more than 2 weeks. Still, the state's new hospitalizations are the lowest they have been since the coronavirus crisis started, and ICU admissions are at their lowest level in more than 3 weeks.
And you see that footage? That's the proof we're showing. Time and time again, they show inside of hospitals, business as usual, no patients lined up everywhere. But we're supposed to believe that this is, a catastrophic event all over the nation, especially in New York. Doesn't add up, doesn't make sense.
All of this data suggests that we are flattening the curve so far.
And that's why one place that was supposed to be a field hospital is scaling back. Beds had been set up 2 days ago at this Manhattan cathedral. They've now been packed away. Meanwhile, logistical issues appear to be part of the reason why the 500-bed hospital ship Comfort has treated only 80 patients so far. What do you say to people in Manhattan who are looking at this saying you got this big, beautiful ship with a lot of room and it's practically empty?
The optics may not be great. We've been working with, the city of New York, FEMA. Any disaster emergency response takes a little bit from a coordination perspective.
There are moments of joy happening around the country. In Missouri, 87-year-old Don Lockmiller has survived the coronavirus. He spent 10 days in the hospital.
An almost 90-year-old man survives. Huh. How is that possible with such a deadly, dangerous pandemic? An almost 90-year-old man is being wheeled out of the hospital. Things that make you go,
And is now home. But the virus continues to spread in places in the Midwest. In Michigan, the number of deaths in a single day was expected to peak on Thursday. Detroit nurse Jennifer Rauco says she saw 3 bodies taken to the morgue in one shift.
That's a bad day, but unfortunately, there are days that has become a normal.
In Flint, Michigan, Sandy Brown lost her husband, Freddie Brown Jr., and her 20-year-old son, Freddie III. They both died from the coronavirus in a span of just 3 days. They are 2 of 4 parishioners from Pastor Kiemba Nolan's church that died this month.
I get speechless, I get a little...
And there's your mockery of God and Jesus. They put these stories out there and, show inside of a church and these parishioners that have passed away because it's a mockery of God. They should just come out and say, well, see how much God does, see how much God cares. Where's your God now? It's killing off church members.
Emotional because of the effects that is happening in America. But then come again, here it is in the Black community.
Freddie III had hoped to walk on to the Michigan State football team. His dad helped to organize church services. Here's an example of our new normal in America. Sandy will bury her husband and her son today. Groundsmen at the cemetery will carry their caskets to the grave, while Sandy is asked to sit in her car and watch.
Okay, so of course they have to pull on the heartstrings, and I'm not saying these people did or didn't pass away. I have no idea. And if they did, that's really sad, obviously. And my condolences to their families. But why are these families okay with the media using their family members as a way to push more fear and more propaganda down everyone's throat so that they can bring in their pre-planned solution? And why are they not kind of curious about what's going on with the CDC's numbers? Okay, so this is Dr. Jensen. I'm sure some of you guys have already seen this clip. He's kind of been making the rounds on the media, which again, this is coming from mainstream media, so you have to take it with a grain of salt, but we have to consider all the information that's being put out there. And why Fox News would run this type of story, I really don't know. Controlled opposition maybe, to kind of give people little droplets of truth, right? In order to suck them in and make Fox News seem a little bit more trustworthy because they're putting out opposing opinions on things and opposing information. But still, we need to consider this and listen to what this doctor has to say.
Guest is a doctor and state senator in Minnesota who is deeply troubled by the CDC's latest guidance for counting COVID deaths. Dr. Scott Jensen joins me now. Doctor, I want to read for our viewers what the CDC says in part about how to count COVID deaths relating to that last issue we just raised. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. So, doctor, what's the problem with that?
Well, in short, it's ridiculous. I spent some time earlier today just going through the CDC's manual on how to complete death certificates and the parts that were specifically written for physicians. And in that manual, it talks of precision and specificity, and that's what we were trained with. The determination of the cause of death is a big deal. It has impact on estate planning. It has impact on future generations. And the idea that we're going to allow people to massage and sort of game the numbers is a real issue, because we're going to undermine the trust. And right now, as we see politicians doing things that aren't necessarily motivated on fact and science, the public's their trust in politicians is already wearing thin.
And doctor, in that same CDC guidance sheet on COVID-19, it references the fact that basically this is a judgment call for doctors on how to fit, I read it, what goes on line 1, and then what goes on line 2, and what goes on the final line as far as contributing factors and ultimate cause of death. But they concede that it is a judgment call. Again, why is that not correct?
Well, let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days, and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate, and I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia, and in the contributing factors, I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death, and yet that's what we're being asked to do here.
Dr. Fauci was asked about the COVID death count today. Here's what he said in part.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded?
You will always...
Okay, so they're saying there's no evidence. That's ridiculous. I will show you guys the CDC's website, or the CDC's memo that was sent out, saying that it doesn't matter if you have a test or not. If you even suspect it to be the CV, then that's what you need to mark down. With no evidence whatsoever, you still need to put it on the death certificate. So to say that there's no evidence of padding numbers is ludicrous.
Have conspiracy theories when you have very challenging public health crises.
And there's the magic word, right? Conspiracy theories. Oh, that's just a conspiracy theory. So if we call it that, then no one's going to take it seriously, because we have the leading expert in the field, so-called, saying, no, that's just a conspiracy theory, except for the fact that the CDC has come out and said, yeah, just anybody who you might suspect or presume, just mark it down. And then you wonder how the numbers are exploding. Ridiculous.
They are nothing but distractions.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward.
There you go.
Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000.
Okay, so let's consider what he just said there. If that is true, that every time you have a diagnosis of CV, you get $13,000, and every time you put somebody on a ventilator, you get $39,000, I think is what he said. So, in other words, the hospitals and doctors are highly incentivized to mark down anything they want to as CV and to put people on the dangerous treatment of ventilators in order to get, tens of thousands of dollars per patient. So again, I don't know if that's true. I haven't seen it. I don't have any proof of that. If that is true, we have a serious problem on our hands. But what I do know for a fact is true is that memo I'm going to show you guys here in just a second, where the CDC says just mark down anybody and everybody who you even suspect or presume might have it with no testing necessary.
3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do. Some physicians really have a bent towards public health, and they will put down influenza or whatever because that's their preference. I try to stay very specific, very precise. If I know I've got pneumonia, that's what's going on, the death certificate. I'm not going to add stuff just because it's convenient. I think that it's not a conspiracy theory at all.
Yeah. So you reject what he said?
Absolutely.
Well, it's interesting that in Italy, where it's socialized medicine, I guess they don't have an interest in the money, if that's what it is here, and they just went back and they started reclassifying deaths according to their top scientific advisor. So they admitted that they were being liberal or generous in how they coded some of these deaths, and they're just going back and reclassifying them. Does that surprise you?
It really does. I mean, let's just take someone getting hit by a bus and they collapse a lung and they go into the emergency room and they're there for 15, 20 minutes. Blood work comes back, COVID test comes back positive, and they die 20 minutes later because of their collapsed lung. We're going to put that down as COVID-19? That doesn't make any sense.
Dr. Jensen, really important conversation. We really, really appreciate your data-driven perspective. Thank you so much.
So I think that is something that we should all kind of consider at the very least. But here is the memo from the National Vital Statistics System, right, that was sent out by the CDC, where it says, should CV-19 be reported on the death certificate only with a confirmed test? So in other words, should we only mark it down as the cause of death after we've gotten a positive test result confirmed? It says CV should be reported on the death certificate for all descendants where the disease caused or is assumed to have caused or contributed to death. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, and testing. If the descendant had other chronic conditions, such as, COPD or asthma, that may have also contributed, then these conditions should be reported in Part 2. So never mind the fact that a lot of these people who are supposedly dying of CV, they have a number of pre-existing conditions that are serious and would probably result in their passing away anyway. Nope, but according to the CDC, we should just mark whatever we presume or suspect might be CV without any tests necessary to confirm that or not. I mean, how much more obvious can it be that they are trying to create a massive amount of fear and panic? Why are they doing that, you ask? Because they want to bring in their pre-planned solution, the chemical cocktail that they are going to inject in all of us and most likely be made mandatory, all right? Because people are going to be so scared out of their wits saying, we need something done. And yes, not only are they going to be lining up for this thing, they're going to be thanking the government for getting it to them. Okay, the government's going to come in and act like they're the heroes of the day. And it's news story after news story from all the experts and leaders, so-called, saying that, hey, we're never getting back to normal. The lockdowns are not going to go away until when? Until the shot is ready. So here's Dr. Fauci, right, saying return to normal will be gradual, but life may look different until the shot in your arm is ready to go. And then here we have the former FDA head says life's never going to be perfectly normal until when? Until we get the shot in our arm, until we all get injected with the chemical cocktail that the government's cooking up for us behind the scenes. But here's Justin Trudeau, of course, the Prime Minister of Canada, saying this will be the new normal until when? until a shot is developed, until that chemical cocktail is ready to be shot up into everyone and made mandatory, by the way. And of course, we have, the star of the show here, Bill Gates, saying that this is how long it may take before Americans can be completely safe. The shot is critical because until you have that, things aren't really going to be normal. The billionaire philanthropist told Woodruff, they can open up to some degree, but the risk of a rebound will be there until we have a broad shot, telling us straight to our faces what the plan of action is going to be. A mandatory shot in the arm that all of us are going to have to be required to take, or we won't be able to participate in society as normal. What that's exactly going to look like, we're all going to have to wait and see. But clearly, that's the agenda here. One of the biggest, there's lots of agendas going on right now, but this is one of the biggest. So yeah, guys, I just wanted to show you these clips because I could not believe it when I saw this I could believe it actually from CBS this morning, just shamelessly using Potter's Field, the place where they've been using for decades to bury the unclaimed and, people who can't afford a normal funeral. They've been using this for decades, and now they're saying that they're having to dig a bunch of new ones because of all the mass amount of deaths caused by the CV. One good thing about this is, though, when I went through the comments, there is a lot of people who are very much awake to what's going on. So that is an excellent sign. People are at home right now. They're watching all of their rights being taken away. They're getting online. They're watching different sources, and something is not adding up to them. And right now people have, more free time on their hands because they've been laid off of work. They don't have jobs anymore. So they are able to look into some of this stuff, and it's just not adding up to them. So we can see proof of that here in the comment section, and that makes me very happy and gives me a little bit of hope.